Assalamu alaikum. I'm Dr. Najiba Abdulrazzaq. I'm an internist and I'm head of the Infection Control Committee in the MOH. The status of infection control in the UAE is quite excellent. I just wanted to explain the complexity of the healthcare system in the UAE. As I'm sure a lot of people are aware, we've got the Ministry of Health and Prevention covering the greater area of the Northern Emirate, and then we've got different authorities like Dubai Health Authority, Abu Dhabi Health Authority, also other ministries like Ministry of Presidential Affairs. Most of the hospitals have a strong infection control program, and this is also being mandated in certain parts of the UAE, like in Health Care Authority Abu Dhabi. Also in Dubai Health Authority, the governmental hospitals have all been practicing infection control for more than 7 years or even further. Also to be noted that more than 50% of the hospitals in the UAE, whether governmental or private, are already internationally accredited, and all these accrediting bodies require well-functioning infection control practice. The Ministry of Health and Prevention in the UAE is really promoting international standards for infection prevention and control. The main directive currently is to mandate the infection control program in all the facilities all across UAE. And the action plan has already been made and it's ready for implementation, which should be started quite soon. This will ensure that all facilities do have an infection control program that is functioning according to the international standards. Definitely everybody is aware of the importance of infection control and prevention, since it's an important part of patient safety. And this is all what we really aim for. Regionally as well, it is the same situation everywhere. However, how good the penetration of the infection control and the auditing of the infection control varies between facility to facility, and this is what we actually nationally have introduced the standards for having a good infection control practice in the region. As the head of the Infection Prevention and Control Committee in Ministry of Health, there are many challenges. However, it is the general challenges that any country is facing or any facility is facing. The importance of hand hygiene compliance is really very crucial, and though we are reporting quite a high compliance rate, still there are areas that we find it challenging. Also, the prevalence and the emerging of multi-drug resistant organism as an international problem as well, and it is also being faced locally. And preparedness for new emerging diseases is another difficulty that we face. Overcoming these challenges is difficult. It's very difficult to do it single-handed on a facility level. It has to be done on a national level. And this is actually what the Ministry of Health is doing currently. There are national committees from different parts of different health organizations in the country, which have already drafted a plan for combating infection control challenges and antimicrobial resistant challenges. One of the things that we're looking forward in the hand hygiene is to have more external auditors, so it will not be biased in reporting the compliance of the hand hygiene. And this is started implementing in many areas, and we're trying to generalize it into other facilities. As for the multi-drug resistant organism, it's already been evaluated by the National Committee, and the action plan is already being laid out, which will be enrolled soon, and the plan will be audited also in the future. Currently, we are in the process of formulating the task force to audit the implementation of these plans. With regard to preparedness for the emerging infection diseases, there's already a national committee for the emergency preparedness, and they've been doing a great job. They've actually been already involved in the recent emerging diseases like the MERS-CoV, the Ebola, and even the Zika virus, and they've been a good mock training have been occurred in these committees, and it's been showing to have a very quite good response. In the second annual International Conference on Infectious Disease, I'll be presenting the role of Infection Control Committee in addressing the issues related to infection control. As everybody is aware that this is a multidisciplinary approach, and this is what I will be highlighting in my talk. I find this conference is a very important platform for the infection disease, as it attracts many local physicians, healthcare workers that are involved in infection control, also regionally and some internationally as well. And there are very keynote speakers in this conference, which I'm sure will show their experience and their training as well in this field.